Hi everyone, this is the Health Matters program, a comprehensive health initiative from the Ministry of Health. I'm your host, Alicia Martin. Today we're talking about breast cancer awareness, and joining me in the program is Dr. Ravi Motilall, consultant and general surgeon attached to the Georgetown Public Hospital. Welcome to the program, Dr. Motilall.
Thank you, and it's a pleasure to be here.
So today we're talking about breast cancer awareness, and we're observing this under the theme, Many Hearts, One Fight. Tell us, what does this theme mean to all women during this time?
Well, breast cancer is a huge fight, is a huge battle. Every patient I have in my office, once I've made that diagnosis, I like to tell them, you are now part of the team.
All right.
Because patients tend to think that they're on this on their own, and it's a very distraughting kind of diagnosis. And the team usually involves every doctor that's involved in their management, including the oncologist, the surgeon, myself. If they have any comorbidities, I will manage those as well. Some patients require advocates to help them get through this. Other patients. So there are a multitude of individuals involved, and we like to tell them, you are in this fight. You are not alone. We are here to battle with you. So stick with us. We'll get this through together.
Definitely, a collaborative effort is needed. And as we observe Breast Cancer Awareness Month, what should all women know about this disease?
Well, one of the things I like to emphasize is, yes, October is Breast Cancer Awareness Month, but we should not forget that this is a disease that don't really care which month it happens. So there are certain risk factors that put a woman at risk for breast cancer. The biggest one most people here, especially in Guyanese, like to think about, but I ain't got no family history with breast cancer, so why should I be worried? Well, the average risk for breast cancer is not a family history, it is your age. So that's the first risk. So every woman over 40 requires some form of a look into to breast cancer. That could take a number of ways, but when we talk here about screening. But in terms of other risk that can put you, exposure to radiation, the number of kids you have, the higher number of kids you have actually helps. It's protecting the breast because the breast is not going through all those hormone changes. In the past, we were very concerned about contraceptive use, oral contraceptive use primarily. So patients who use oral contraceptive in the past, the ones that we had could predispose you a little bit. Other things that are of concern is age of when you have your first period, which is menarche. Because what that means is that your breast is going through more cycles over your lifetime. So you get your period very early. These days, young girls are getting their periods by 10.
Yes.
Over the years, I've met patients who periods vary. And then the other thing to consider is when you're going to have your first baby. So a patient who has their first baby a little later on in life, their breast is a little bit more exposed. That kind of puts you at risk. And as I mentioned, the number of kids you have, the more better for the breast. I know a lot of women may be like, yeah, but I only want 2 or I only want 1. But at the end of the day, these are some of the things that helps protect you and one of the reasons that you could be at risk. Now, let's talk family for a second. A family history and recognizing if you have a family history with breast cancer is super important. It is super important because if you have a first-degree relative means what? A sister, your mom, etc., or even your dad, right? Because again, breast cancer don't discriminate between men and women. It's just that women has more developed breasts, so therefore they're the ones who's gonna more likely to have breast cancer. So at the end of the day, if you have a first-degree relative, that is very important. You need to take that into account and maybe even consider get checked out before the age of 40, because that puts you at a higher risk. And then there's certain genetic conditions, or what we refer to as something called BRCA. So we will check for those in this day and age, and that actually puts you even at a higher risk. So when we talk about breast cancer these days, we talk about people who are average risk, which is a majority of individuals. Almost everyone, once you're over 40, you are going to fall into that category. The second category is your medium risk, which is patients who may have a distant relative with breast cancer, maybe a second degree relative. So you have a cousin somewhere along the line who had a breast cancer. And then we talk about severe risk or very high risk, which means immediate relative, your mom, your sister, etc. Or you may have a genetic predisposition. You have one of those genes.
Okay, very much interesting. I know a lot of persons might be wondering, how long does this cancer take to develop? I know you mentioned persons over the age of 40 are likely to develop it, but how long does it take to develop?
All right. So the tricky thing about breast cancer is that it can vary based on the type of breast cancer you have. And therefore, early detection, which is one of our team in the previous years, save lives.
Yes.
If you remember a few years back, I think that was one of our team, early
Yes, it
detection,
was.
save lives. And for that reason is that we want to detect it very early because we don't know. So generally, all cancer go through one of three phases. And those phases are rapid development and progressing, quickly. There's the one that develop and then slowly progress, which is just a very small percentage of cancers. And then there's the one who everybody reads about in the internet who says, oh, I've had breast cancer for 10 years, nothing happened. Those are a different type and it's a very, very, very small population. What does that mean is that the cancer is growing very slowly. Okay. But those are extremely rare cases. Those are not the one you want to follow.
Which means it might not be the same for everyone.
Exactly. Exactly. So in terms of, do I have time to wait and see what happens? No, because breast cancer is not preventable. You're going to be at risk, and our job is to capture that early on, and in that way prevent it in a sense. Because with a very early cancer has very good outcome, versus if you're diagnosed a little bit later, then that's where the problem comes.
What are some of the symptoms of breast cancer?
That's a great question. Excellent question. And part that what I find a lot of people say to me when they come with their breast lump, which is usually late, by the way, if you come with a lump, you're actually a little bit late.
Wow.
And one of the things they say, but doc, it's not hurting me. It's not hurting. That's what they say very often. But that's the thing about cancer. Cancer don't hurt until it gets very late.
Wow.
So breast pain is one of them, but it's not the first one. All right. So if you're developing breast cancer, the first thing that you may not notice is a lump. Now, don't wait on that lump. Don't wait on that lump to disappear, especially if you're over 40 or you're close to 40. If you notice a lump, you want to get checked out. You want to come in, you want to see your doctor, you want him to examine you, and then maybe investigate that further. Because in this day and age, we really, I've seen, I don't know, maybe thousands of breast cancer in my career. But still, it's very difficult to just touch it and say yes, unless it's very late. Usually, if it's very late, we can just look at it and see. Because some of the other symptoms you will see is that the patient may have what we refer to as peau d'orange or orange peel skin.
Wow.
This is usually late again. If you have a bloody discharge from your nipple, that also can be a sign of breast cancer. It is not the only reason why you can have bloody discharge, but it's something that you should take seriously. If you notice a lump under your arm, again, you should. If you notice one breast is looking bigger than the other, suddenly you should. There's one particular breast cancer that has a very poor outcome that really requires our attention, and that's called inflammatory breast. It is not the most common one, but what happens, the breast looks like if it's just infected. And unfortunately, a lot of women think that they start antibiotics on their own, but it's actually cancer. That's another thing that you should take into consideration, get looked at early. And it's a difficult one because sometimes even your physician, your family doctor, etc., may not be convinced. It requires some degree of suspicion, but all of these things should be taken seriously. Not just wait to see what happens. That doesn't help us very much. And I say us because you are part of this battle.
Yes. And definitely everyone is affected by it. As we mentioned before, early detection saves lives. And we want to know, what can persons do? You mentioned early screening as well. Tell us about this screening process. What is this like? What type of screening?
Right. So first, let's talk about what's been happening. I think that's important. It's important to differentiate what was happening and what needs to happen and what is going to happen.
Yes.
It is all part of the strategy of Ministry of Health. is initially we used to talk about self breast exam, and there's still a lot of women out there who do self breast exam and think that's okay. But self breast exam is not really a screening strategy. It is not a way of preventing or capturing, or rather, I should say, early breast cancer. WHO says it's a good way of empowering a woman. And it's true. You are taking responsibility for your own health, so you should do it. But it's not the ideal way of screening for breast cancer. Then there was talk about you seeing a physician and him examining the breast as part of screening. Well, that has also become a little bit, wanting to say antiquated, is that, again, even someone who's seen so many, it's not an ideal way, because what we want to do is capture the cancer at an early stage. So none of those methods allow us to capture it early, because unfortunately, the only way those methods can help you is if we feel something abnormal. So the current accepted standard way of doing breast screening is a mammogram, what's referred to as a screening mammogram. Now, mammograms are special X-rays that we use to evaluate the breast. And now we have people who are trained in radiology to do more, look at the breast themselves, and give us a report. And that is the acceptable standard currently for breast screening. Because what that mammogram allows us to do is see the very early subtle changes, minute things that we can't feel but can be picked up on an X-ray. And then that gives us an opportunity to now classify it in terms of assessing your risk. Because not every breast lump means it's cancer.
Correct.
So let's not go there. What the screening method allows is for us to now categorize women who may even have a lump and say, well, this lump is not cancer, this lump is benign. And there are special scale method that a radiologist or a surgeon may use that we will look at the image and says, well, it falls into this category. You don't need to be worried. And see you next year for a new screening, which should happen. Currently, the recommendation is every year.
Every year.
For a woman who's over 40. But it could vary. It could vary. In some countries, they do them every 2 years. But I think here in Ghana, because of how prevalent breast cancer is, breast cancer is the number one diagnosed cancer in women at the moment. It has been a tossed up and down. It dropped off the scale a couple of years ago with things like cervical cancer, but it's way up there now, and therefore it's an important battle. It's an important battle for you as the women out there to take that into hand.
Definitely. Thank you so much, Dr. Motilall. You mentioned the mammogram, and I know a lot of women have different perceptions when it comes to that. Some women think, okay, my breast is going to get squeezed. What should women expect whenever they're
Yeah.
preparing to go get a mammogram
Yeah,
done?
that's a very good question, and I'm smiling because I remember we had this course sometime early in the year with a group that does a lot. This is all they do. They manage breast cancer, and it's a little bit like in the gym where you say no pain, no gain. In that, yes, you will experience some discomfort, but it is that discomfort that gains us an opportunity to capture that cancer earlier. So preparing yourself that, look, I may be uncomfortable, but feel free to tell the technician, look, I feel a little uncomfortable. It's a little bit too much. Technicians are now trained to look at methods in which they can relieve that,
Yes.
or says, just hold 1 minute, so that they can get that. So that's one of the things to prepare their mind. But it starts even before that, right? The fact that you may be in a cold room, the plates are cold, just preparing your mind for that is nothing to be afraid of. So there's no surgery involved in a mammogram. It's just like an X-ray. If you ever had an X-ray before, the only difference is that unfortunately they'll be sandwiching your breast a little bit. But as I said, sometimes it is what is necessary to get the information that we can use to really benefit in this fight against breast cancer.
Definitely. Thank you so much, Dr. Motilall. We're going to go into a short break and be right back with more on breast cancer awareness.
Hi, how can I help you today?
Are we at risk for cancer?
I read online that lifestyle factors like smoking, eating junk food, a lack of physical activity, and a family history increases the risk. My grandmother had breast cancer.
And my dad has colon cancer.
Have you had any cancer screening?
No.
Considering your family history and age, it is advisable that you be screened. Are you interested in discussing your options and scheduling the screenings?
Yes, please.
Cancer is the leading cause of death globally, but you can take steps to prevent it. Maintain a healthy lifestyle, eat a balanced diet, and add daily exercise to your routine. Early detection is the best prevention. Visit your nearest health center and discuss your risk factors. Screening and treatment options are available if required. Proactive choices today can lead to a healthier tomorrow. A message from the Ministry of Health.
Cervical cancer is on the rise in Guyana. It's the second highest cancer affecting women in our country. I wouldn't wish cancer on anyone. As a cancer survivor myself, I know how hard it is to battle cancer. And only recently, one of my family members, very close to me, came down with cervical cancer. Oh, how I wish that she had got tested before so that we would get an early diagnosis. So I'm asking you, please get tested. Please do your VIA, do your pap smear, and also get your children vaccinated. HPV vaccination works. It will save them from getting cancer in their later years. So please join this fight. Ensure you do the right thing so that you wouldn't have to worry like I had to.
Welcome back to the program. For those of you who have just joined us, today we're talking about breast cancer awareness, and joining me today is Dr. Motilall. Dr. Motilall, could you tell us the importance of support and community?
It is huge. Early on in the talk, we talk about a team. One of the areas that, maybe we may not consider it a team, but they're like the cheerleaders. Your community is your cheerleader.
Indeed.
Okay? And that's the way I think we should look at it. Here in Ghana, we deal with a lot of myths and rumors and what your community says to you about breast cancer. Oh, if they cut it, it's going to get bad. Oh, just ignore it, it's fine. Oh, I had one of those, drink this medication. So communities play a big part. Unfortunately for us here in Ghana, community has not always played a positive role. What I want to say to the Guyanese population out there, it's time for us to think differently. If there's someone who has been diagnosed with breast cancer, you're their support, you're there, how are you doing? You're gonna get through this. That's very, very important. And be careful not to spread the wrong news.
The wrong information, indeed.
Anybody can get breast cancer, man or woman, by the way. Anybody can get breast cancer, so it affects the community across the board, and you don't know who's going to be next. So it's very important that we play that supportive role for our friends, our family, and our neighbors. Supportive role in that sometimes when they're going through treatment, they may not be, strong enough. People with breast cancer a lot of time has to go to chemotherapy and they may be weak. It's important if you can give a helping hand. Maybe I've had single moms who's been diagnosed. I've had, people who are struggling economically. All of these things are so important. And, again, I said, a lot of times we focus so much in October about breast cancer, but I think the community should recognize and play a huge part.
Yes.
And not only your immediate community, commercial communities, people who are, businesses, etc. All of that can play an integral part throughout the year in supporting people with breast cancer. Because a lot of time they come through the system, we're able to identify the ones who are going to be struggling. They may not even be able to come in for treatment because, their jobs don't allow them to. I've had patients who've missed chemo because this is, doc, I had to work and this kind of thing. And it's very, very important that corporate Ghana also come to recognize
Indeed.
that and move away from that stigma, okay, and be very, very supportive for people. And I think if we are taking that stand, that position, I think we'll be able to get through a lot more patients. to cure, to what we refer to as cancer survival, you know. So because a lot of time people struggle with that diagnosis. They don't know
Yeah.
what to do. They don't know who to say it to because they're afraid that it could be judged. And there's one other part of the community I really want to touch on that has been identified, you know, during our interviews as on an example basis, on a day-to-day basis, is the impact that community leaders have.
Wow, yes.
Community leaders, you play a major, major role. And community leaders means your pastor, your priests, your pandits, you know, religious leaders. Community leaders means, you know, people who have maybe a statutory position, chairmans, etc. Community, these are all community leaders, professionals within your community. These are hard stand people who can either be an integral part of this fight or sometimes they can be your worst enemy. And it's very, very important for us to recognize that, you know, God did tell us, you know, he will help those who help themselves. And yes, we want you to pray. We want you to be faithful in that sense, but recognize as well that he's also blessed us with the knowledge to figure some of this out. And we need to follow through with that, because if not, we're gonna lose that fight. Over the years, very early on in my career, it breaks my heart every time I see people who unfortunately have been given the wrong advice and we lose them. These are young people, these are people who are, you know, have kids, etc., just because they've been given the wrong information. So interviews like this hopefully would help to disseminate that information and break that stigma that comes with you know, giving the wrong information about breast cancer and breast lump and so many other diseases.
Indeed. And as we wrap up today's program, what would be your encouragement to women and persons out there who haven't yet done a mammogram and they're at that age? What would you like to tell them today?
Well, for starters, we do have some limitations in the mammogram scenarios in terms of the limited number of mammograms. But I would say to you, as best as you can, once you've seen a physician, try to get a mammogram. Okay? Once you're over 40, especially if you've had a family history, you can try to get mammograms. Mammograms are free in the public system. It's just a matter of getting scheduled. Your physician, your community physician, can refer you for a mammogram if you're over 40. They can assist also by simply doing an exam so that if you do have a lump, you can go on a higher priority list for a mammogram versus, you know, if you do have a little bit of a waiting list to wait some time to get a mammogram. But you should start, you know, women out there who are over 40 should start getting their routine mammograms so that we can get this process started in preventing breast cancer.
Definitely. And as the team says, many hearts, one fight, and it's a collaborative effort.
It is.
Thank you so much, Dr. Motilall, for joining me in the program today. And I encourage you to keep up the good work that you have been doing at Georgetown Public Hospital and beyond.
Thank you. Once again, pleasure being here and happy to help in any way I can.
Thank you for joining us on the program today. I'm Host-Alicia Martin saying goodbye for now.
Yeah.